children, especially, to start school, we start that process as soon as we see them on the first visit. So that's a very tiny bit of what we do is vaccines, but that's what comes up.
Thank you. I think this one would like to add something.
I just want to add and maybe ask those people who work with, in medical field. With the issue of immunization, I think the problem we have is some refugees might have had those vaccinations, but that they don't have documentation for it. And then if you have to enroll kids in school, the school have to have documentation that they have been immunized. So when you go to, whether you go to Score Hill Health Center or to the Department of Health, sometimes then they will give them the immunization that they don't need, but because they have no record. So we try to make sure that we go through all the documents they have, because sometimes they don't know that they have the immunization. So, if you are a service provider, sometimes with the communication not going so smoothly, you can always ask the refugees if they have other papers you haven't seen, because sometimes they might have records of things that they have done or the immunization that they have been provided, so that we don't have to double up if it's not necessary.
Yes, and if they have actual documentation, we will try to do that. We're certainly willing to do that. But just like they are required to have certain immunizations in country, in the refugee camps before they come here, if they don't have documentation, they will receive those as well. In order for them to go to school and get, or to get their green cards, they must have documented vaccines here, and it won't hurt them to be doubled up if they have to. So if there's no documentation, they really need to have it anyway.
Thank you. And
we sometimes do titers as well. If a family member thinks that they might have gotten one, we can do blood work to make sure that they have.
The rest of the questions are all around the issue of psychological trauma, how people can be helped. We talked about the ways that people can be helped by connecting them to the community, and the paper that we give you talks about that, how the social connections and the connections through faith and cultural and supports in their community are very important. But also, we know that there's people that are going to need counseling and people that are going to need direct support. So we do have, there are some providers, but one of the reasons that we're here is because we know that we don't have enough. One of the things we hope would come out of that would be some people meeting to talk about getting together and making some plans for some ways to help people heal. Maybe some specific ones with women around experiences they had, just to help identify and begin finding ways to meet those needs. One of the things that our Immigrants and International Advisory Council is already working on, and we think this would be a good model here, is to develop what we call sort of support groups. We didn't want to call them mental health groups because that has a stigma to it. But we think that for a lot of cultures it's very appropriate for people to get together in groups and build the strength in their own community and talk. So our plan is to have professional psychologists and doctors to train lay leaders in the community and mentor them and help them lead groups and call them around different issues. Like one is stress management, or women's issues, or communicating with your husband, or just have ways for people to begin to process and get the support that they need and help them to recover from their trauma. And I know it's in a different level. That's what's happening with the other resources that we talked about in art and church. But this will be a way that we are directly going to want to organize. So we would hope that in the networking time, which is coming next, that we would have some people come together and begin to plan to meet further, more times about that. And we also, with any of the other needs and concerns people have, we also would like to, when you see the resource tables and meet and talk to people, to begin to build relationships and make plans for how to work together in the future. So I think now we can move to the resource time. I think this has been a wonderful, wonderful discussion, and I want to thank again all the participants of both the panel and in the audience, and the moderators and the presenters for coming today and helping us begin to get prepared for our next group of refugees that are coming to Pittsburgh. So on the back of your agenda is resource contact information for groups that are here today, as well as some links to resources that we thought you would be interested in. And there are resource tables. There's information from the Department of Human Services. There's information from each of the groups here. The refugee resettlement organizations are here. There's information about a program called Language Link it's very similar to hearing and deaf services, where you call for an interpreter to come to a meeting, and they're going to be working together with other interpreters in the area to help connect them and have certified interpreters available. So now, is there anyone who isn't on this sheet and is in refugee resettlement who would like to be acknowledged as a resource person? We tried to catch everyone who might be and put a name tag on. So do you want to identify yourself yet?
Yeah, I just want to say I'm Joseph Rinson with the UTMC Center for Inclusion. I know we have several of our providers throughout, but for any of you that are connected with particular community groups, we actually have both a Workforce Development Community Council as well as a National Patient Relations Council. So if you are not currently connected with either of those, feel free to come see me so that you can be a little bit more directly in contact with UTMC providers.
Holly Coleman with the Greater Pittsburgh Literacy Council. We do English as a second language and workforce development. We have one of those families with a job with us right now. Thank you.
My name is Angela Miller, and I work for Council of Three Rivers American Indian Center Early Head Start. And our agency, we do home-based visiting for pregnancy through age 3. So it's a really good resource for these families that are coming. One, they get somebody who speaks English in their household once a week for an hour and a half each child. And another thing, we promote parenting, and just it's a good way for them to learn cultural norms here in America. So if you have any questions about babies,
Yeah.
Hi everybody, good morning. My name is John Covell, and I'm the ESL Director for Pittsburgh Public Schools. Hi, sorry, a little sore throat this morning. My name is John Covell, and I'm the ESL Director for Pittsburgh Public Schools. So if anyone has any questions about school enrollment or the ESL program in city schools, I'd be delighted to talk to you. Thanks.
Hi, can you hear me? My name is Dina Clark. I'm the director of our Center for Race and Gender Equity at the YWCA, Greater Pittsburgh. And the YWCA has a women's resource center here downtown and one in our home of Rushton branch. We help women connect with a whole variety of services, which includes housing, childcare, food, and lots of other job resources. So I would encourage you all to connect with us as well.
I'm Gwen Steiner with the Alliance for Infants and Toddlers. We're the Birth to 3 Early Intervention, and I coordinate a team who works with refugees, non-English speaking, or ESL families. So we work in the home with those families as well, and contact me and we'll help you out.
And real quick, her and I service different areas. Just so everybody
I have the
knows.
whole county. I know. We work together.
Yeah.
We're the same
But a
family.
lot of the agencies that service the children, we go by zip codes. So just so you know, you wouldn't be doubling up.
Yeah.
Basically.
I'm Norm Ann Rothermel. I'm the State Refugee Coordinator for the Commonwealth of Pennsylvania. We provide funding for providers to provide the needed refugee services after the initial resettlement period. We also have funding. We work with the Department of Health, pass money to them to provide health services. We have refugee school impact grant services, elderly services, employment services, and we're trying to get more mental health services going, which I know is very much needed. And we also do provide help with issues involving the county assistance offices. So if you have any welfare questions, please feel free to contact our office because we'd be happy to help you with any welfare issues involving refugees.
I want to talk about the Pittsburgh Culture Trust. We are working with them, of course, with the public school. I already mentioned that. In June 22nd, over at the Bayam Theater, there is a group from Congo is coming to do a cultural program at the Bayam Theater. So it's called Congo Fest. Of course, like I say, Pittsburgh is getting involved about